a devoted promoter of nature therapy and plant medicine as effective healing and wellness at least cost or no cost at all. Certified lifestyle medicine physician, diplomate of International Board of Lifestyle Medicine. She also practiced OB-GYN and family medicine. She is a retired director of Antique Medical Center with a master's degree in hospital administration. She also an officer in the Philippine Army Reserve Force and is distinguished awardee in the medical field in the province of Antique. Thank you.
Thank you, Claire. Good evening, everyone.
Good evening, Doc.
It is nice to know and always remember that God has given you the power to heal yourself. Just awaken the healer in you and be in the driver's seat of your health. So let us learn lifestyle medicine, now recognized as the best medicine for everyone. Okay, we will start. Okay, we'll start with this. What are the top 5 causes of death worldwide? It is, they are 1, cardiovascular disease, respiratory disease, cancer, diabetes, and stroke. And they are all lifestyle related. And I can see my screen. And what are the 10 leading causes of death in the Philippines? And these are these are the topmost. Chronic lower respiratory infections, or COPD, or chronic obstructive pulmonary disease, hypertensive diseases, diabetes mellitus, cerebrovascular diseases or stroke, neoplasms or cancer, and ischemic heart disease or heart attack. And these are the 4 major NCDs in the Philippines. NCDs are non-communicable diseases. They are not infectious. And these are cardiovascular, again, heart diseases, cancers, COPD, and diabetes. And this is the big picture. The 4 risk factors are physical inactivity, unhealthy diet, tobacco, harmful use of alcohol. And these non-communicable diseases are, or they result to cardiovascular disease, diabetes, cancer, chronic respiratory diseases, and the 2 conditions are mental disorders and injuries. So what is lifestyle medicine? It is an evidence-based approach because it is based on scientific studies to preventing, treating, and even reversing diseases by replacing unhealthy behaviors with positive ones, such as eating healthfully, being physically active, managing stress, avoiding risky substance abuse, adequate sleep, and having a strong support system. And so these are the 6 pillars of lifestyle medicine or areas to improve health. And the first is healthful eating of whole plant-based food. Increase physical activity or exercise. Develop strategies to manage stress. Avoid risky substances, smoking and alcohol. Improve your sleep. Form and maintain relationships, family, friends, and other support groups. So we will just pick up 3, no? Heart disease, what's that? Hypertension, and diabetes. Okay, the first is heart healthy. This is American Health Association Life Check or Life Simple 7 to stay heart healthy. So you have to check to prevent heart disease. You have to check your diet. Is it healthy? Heart healthy diet. Your weight, healthy weight. Do you exercise? Smoking? Your blood pressure, your cholesterol, and your blood sugar. Next is, we will discuss them later. Next is diabetes. Diabetes. And the first invention in diabetes, if you have the CPGs or the official treatment, the first intervention is lifestyle medicine or lifestyle therapy. That is nutrition. So you have to maintain optimal weight, calorie restriction, plant-based, no animal products. High polyunsaturated and monounsaturated fatty acids. Good fats. Physical activity or exercise. So you have to do 150 minutes per week moderate exertion such as walking, stair climbing. 150 minutes a week means 30 minutes a day, 5 times a week or more, or depending on your present condition. Strength training, that's with the use of weights or stretch bands, which you can increase as tolerated. And sleep, about 7 hours per night with basic sleep hygiene. Dapat yung the right environment, na dark, quiet, no sounds, no cell phones. Behavioral support, that is community engagement, alcohol moderation, and smoking cessation, no tobacco products. That's why they emphasize the plant-based diet. And the third is cancer. These are the cancer prevention recommendations of healthy lifestyle or lifestyle medicine. Maintain a healthy weight, move more, eat well, enjoy a plant-based diet, reduce red meat, so no meat and animal products, avoid processed meat from fast food restaurants, cut down on alcohol, eat less salt. And after treatment, or if you are a cancer survivor, you should follow the cancer prevention recommendations still. If you can, after breast cancer, you can breastfeed your baby. And for cancer prevention, don't use supplements or synthetic medications. And always remember, do not smoke or chew tobacco. So what is healthy lifestyle? Healthy lifestyle means practicing good health habits and giving up harmful ones. It should be practiced by the whole family and should be started at a young age. That's why we should have our support. So we should learn first what is health and wellness. So health is a state of complete physical, mental, social, emotional, and spiritual well-being, and not merely the absence of disease or infirmities. Wellness is that an individual can be healthy, even if one is not disease-free, by making more positive health lifestyle choices. Even if you are diabetic or even if you have cancer, you can still be well. Optimal health, as we commonly refer to as wellness, can be defined as the process and state of a quest for maximum human functioning that includes the body, mind, and spirit. First and foremost, a choice to assume responsibility for the quality of your life. It begins with a conscious decision to shape a healthy lifestyle and the optimal functionality of an individual, regardless of current health status or disability. The constant conscious pursuit of living life to its fullest potential. Of course, wellness is multidimensional because it is spiritual, emotional, intellectual, physical, cultural, occupational, social, and environmental. And these are the factors to total wellness. Diet, as mentioned, exercise, sleep, hydration, we need water, sense of calm, relaxation, happiness, and of course, regular checkup if you have a disease already or ailment, or if you want not to have or prevent diseases. So more tips, take time to eat the right food. Keep hydrated. Drop everything and rest. Practice random acts of kindness. Manage stress and anger. And now I will start with the body and later with the mind, soul, and spirit. In the body, the common denominator is inflammation, because visceral adipose cells produce significant amount of pro-inflammatory cytokines na papa-inflame ng ating cells. And the most common cause is obesity. And these are the medical complications, the itis of inflammation in the different organs of the body, and that is from the brain, stroke, in the eyes, cataract, heart disease, which is from, if you have diabetes, high cholesterol, hypertension, pancreas, cancer of the breast, uterus, cervix, colon, esophagus, pancreas, kidney, prostate, phlebitis, or venostasis, skin, gout, osteoarthritis or joint pains, gynecologic and reproductive organ inflammations or diseases, gallbladder, and liver, so non-fatty liver, and pulmonary disease. So obesity can cause all of this. And to fight inflammation, we have to increase our resistance to illness. The field of immunity is continuously reshaping, as is our inner ecology. Discover fortifying lifestyle practices, herbs, foods, and more to enhance your adaptive and innate capabilities. So, what are you feeding your body and your family with? On the left or on the right? As a general rule, we have to minimize or avoid saturated fats and trans fats, and these are fats found in processed foods in fast food restaurants. They are pro-inflammatory. So nutritional advice, eat whole foods as whole or foods as grown, not processed. Eat a variety of foods. In fact, they say eat a rainbow of food because they are more on antioxidants. So every bite you take is either fighting disease or feeding it, not yourself, but the disease. So these are fruits, veggies, tubers or root crops, whole grains, and legumes. And legumes are the best fiber source because we cannot eat meat or animal products. Healthy eating may be best achieved with a plant-based diet that encourages whole plant-based foods and discourages meats, dairy products, and eggs, as well as refined and processed foods. Yes, dairy products because from cows, they sometimes receive hormones and antibiotics and they go to their milk and it can go to us. Hydration, because we are made of 60% water and our circulation depends on water and our vitamins and minerals and water or whatever elements our organs need are through hydration. So upon waking up, 1 glass of water helps activate internal organs. 1 glass before bath helps lower BP. If you warm water is preferred. 2 glasses 30 minutes before meal helps digestion, and 1 glass before sleeping helps avoid stroke or heart attack at midnight. Next is exercise or movement. So at least 30 minutes of exercise most days of the week, 150 minutes per week, moderate intensity exercises, 75 if it is vigorous exercises or heavy exercise. And if you have a pedometer, you have to attain 10,000 steps per day. And sleep or rest and sleep. So it is recommended that adults sleep 7 to 9 hours per night. Oh, there are corresponding number of hours for the different ages until your senior age. Insufficient sleep is a public health epidemic. An average person sleeps approximately 1/3 of their life, but stealing a few hours is now the new norm. We should remember and should be warned that our body repairs during sleep. So sleep. With the industrial way of living and working, sleep issues affect everyone. So learn about powerful tips, herbs, and more to regain control of the main regeneration tool for your body and mind. Next is healthy relationships. So you have to nurture relationships. Support and be supported by the people you love. If you are physically apart, schedule video chats or online conversations. Be kind. Listen to each other. Express your feelings and listen to the feelings of others. Call friends. Connect in whatever ways you can. And next is stress management. This is, I think, the most, the most important. And what is stress? It is the response of the nervous system to stressors that are too large to handle. And the stressors are outside strains, barely tolerable pressures that bring us unhappiness and eventually disease. Stress is necessary for life, so we have good stress as well as bad stress. Good stress is needed for creativity, learning, and your every survival. It is only harmful when it becomes overwhelming and interrupts the healthy states of equilibrium that your nervous system needs to remain in balance. Stress in the community or the family. The death of a loved one, divorce or separation, loss of a job, increase in financial obligations, and getting married. Is getting married stressful? Stress in the community, chronic illness or injury, emotional problems, taking care of an elderly or sick family member, traumatic event such as natural disasters, thefts, rape or violence against you or a loved one. How can you manage? How can you do about stress? The good news is you can learn ways to manage stress. To get stress under control, find out what is causing stress in your life. Look for ways to reduce the amount of stress in your life and learn healthy ways to relieve stress or reduce its harmful effects. So one is Lagaw therapy. Lagaw is you travel or nature therapy. So most of this is in Antique because Antique is where the mountains meet the sea. What is nature therapy? We emphasize this here in Antique because Antique has a beautiful nature. Nature heals as well as reflects the brokenness we find within ourselves. Take solace in the terrible beauty and fierceness of the earth's landscape. So this is in Aning Alan and in Antique. And here too, this is in Aning Alan, the lake, the forest. This is also in Aning Alan. This is called the Ice Cream Mountain. And these are the forests that we roam in Aning Alan. This is also in Aning Alan. And these flowers are the forest beauties in Aning Alan. The rainbow, the perfect one. And this is the lobata, the Rafflesia lobata. It is only found in Antique. There are two species found in Antique, the speciosa and the lobata. And this includes forest bathing. What is forest bathing? It is a healing technique that restores the physical and psychological health of the human body through the five senses experience. So, what you see, what you smell, what you hear, what you touch, and what you taste when the body is exposed to a forest environment. And that is in the hinterland of Aning Alan. What are the interventions? Yes, walking, meditation, yoga, sightseeing, and crafts. The five senses, experience, and exercise are the core. So forest bathing increases positive emotions and decreases the negative ones. And the healing effects for chronic diseases, it can regulate blood pressure, reduce blood sugar, regulate endocrine activity like thyroid and others, relieve mental disorders like depression and anxiety, fight cancer, boost immunity, and treat respiratory diseases such as asthma and COPD. And this is another yoga. It means union in Sanskrit, which is the language of the ancient India, where it originated. The union occurring between the mind, body, and spirit. By asana, the practice of physical postures or poses. And one needs to maintain a constant balance between stretching and relaxing, between strengthening and gilding, and between the quietness of the inner self and the performance of our outer body. It is said to provide a balanced and wholesome approach to achieving perfect physical and mental health, happiness, and tranquility. Once the body is free from physical tension, it's easier for the mind to relax. Sleep improves and your immunity gets a boost, so you stay healthier. It is also called a sacred movement. We are all born to move our bodies. Learn why movement is a recognized medicine from ancient to modern science and explore some easy movement practices for vitality, flexibility, and flow. And these are the yoga practices we have practiced or promoted in Antique. Some of these are doctors who are also stressed, and these ones are the nurses. This some some are teachers, which are also stressed, and business people. Some people don't know this. It is a healing hand yoga. It is just the performance. It is easy to perform anytime because you have your hands anytime. Often, this will provide instant relief with lots of ailments. Regular practice will contribute to your overall good health and can be used as a preventive measure. They not only work on your body, they also work on your mind. So it can work within seconds to 45 minutes to be performed with both hands at the same time. Start within 10 minutes at a time and increase up to 3/4 hours for best results. The fingers should remain comfortable and not held stiff or tight. They are called mudras. I'll give you just one example. This Gyan mudra. The thumb and index finger are brought together gently while all the other fingers remain upright. Right. This one. Oh, can you see? It is just the thumb and right index fingers brought together. So the uses include mental peace and concentration, sharp memory, spirituality, insomnia, stress, depression, develops telepathic, clairvoyance, and extrasensory abilities. As simple as that. There is also a laughter yoga. It needs no tricks, no tickling, no alcohol, even no jokes. Laughter comes from the heart as a pure joy. The activity is non-political, non-religious, non-racial, non-threatening, and non-competitive. Because normally, as a kid, we laughed 400 to 500 times a day, and now, as we age, it is down to 10 to 15 times a day or none at all. It is also called Hasha Yoga. It produces deep scratching belly laughter. So it's also a exercise for the lungs and the abdomen. Forgive and forget. Yogic breathing and exercises. Laughter as a reward. Simulated to stimulated laughter. So you can laugh without cause, but don't laugh alone or the people will laugh at you. Another is Tai Chi, self-paced, non-competitive series of flowing body movements emphasizing balance, relaxation, conserving circulation of vital energy, calming the mind, reducing stress. The benefits are improved coordination and more restful sleep. Shibashi is also the same. This is like a dance. This is a patient in our wellness clinic, and she is a retired judge. She's also stressed. And these are the employees of the Department of Health, which are also stressed, especially now. This is what we also need. Mental health is a state of well-being. An individual with a healthy mental health realizes his or her own abilities and able to manage and cope with the normal stresses of life, work productively and fruitfully, and make contribution to the community. So there is no health without mental health. And also maintain your emotional reserves, and that is emotional health. Develop mutually supportive friendships and relationships. Pursue realistic goals which are meaningful to you. Expect some frustrations, failures, and sorrows, and always be kind and gentle with yourself. Good emotional health. This is a good balance between leisure time, activity, and work. You feel good about yourself, free from self-esteem issue. Believe there's a purpose to life and accept changes better and go with the flow. Enjoy living, know the value of fun and laughter, less stress or better equipped to deal with stress, better relationships with others, content with their lives. And these are the people 50 years and older, staying fit and healthy, becomes more important than ever. And as the body ages, it loses its ability to bounce back from unhealthy lifestyles the way it could in younger days. Hmm. Battery is running low. Okay. But those who practice or maintain healthy lifestyle has better health or healthier and more productive in their lives. Another is massage. Working of the superficial and deeper layers of muscle and connective tissue using various techniques to enhance function, aid in the healing process, and promote relaxation and well-being. So what are the health benefits of massage? That is pain relief, lowers depression and anxiety, lowers the blood pressure and heart rate, activates parasympathetic nervous system, which may stimulate the release of endorphins and serotonin. And these are the hormones of happiness. Increased flow of lymph, improved sleep, relaxation, and well-being, aids in general wellness. So these are the stress reduction massage we introduce in our community works in our barangays. This was piloted in 5 barangays in Pandan with good results. And anthroposophic medicine. Some of us here in the ESA are members of anthroposophic medicine or LAMP. Extends medicine beyond the physical understanding of health and illness, healing of the body, soul, and spirit. And these are some of the treatment modalities: art therapy, eurythmy or movement therapy, nutrition, among others, and external treatments like foot bath and liver compress. This is eurythmy therapy. This is also part of anthroposophic medicine. It is called harmonious movement. It is used as preventive medicine for acute and chronic conditions and leads to balance in the patient's body, soul, and spirit constitutions. It is also called gymnastics of the soul. So this is during our IPMT or international postgraduate course in anthroposophy. And this is our community-based LM practice here in Antique. Wellness practice has been practiced here in Antique way back in 1992 yet, when we had the anti-smoking program, which led to the first anti-smoking provincial ordinance here in Antique. And it was appreciated by the World Health Organization and the DOH. So this is our Philwell Clinic in Colasi. This is in Pandan. And these are the selected barangays in Pandan. So it includes these activities. First, we have a minimum of 3 sessions, but maybe more. Introduction and orientation of lifestyle medicine, wellness and healthy lifestyle clinic, anti-smoking advocacy, exercises, stress reduction massage, external treatment. And we have our clinics under the trees. This is also community-based practice in a wellness clinic and outside. This is in Colasi, where we practice external treatments. And this circle is called the threefold walk, which is also an anthroposophic exercise. And these are stretching, rotating. These are also our practice introduced to them. Look at the 4 with a child also enjoying. And this, we bring this also to the islands, and this is Mararisan Island. So Our patients are mostly senior citizens for the elderly. And this is the Antique Medical Center. Even before the Lifestyle Medicine Center was opened, we were already practicing wellness, health and wellness and lifestyle medicine. And this is Dr. Palma, and she is now the president of the Philippine College of Lifestyle Medicine. And we have also invited in Antique Medical Center our mentor in anthroposophic medicine from Kidapawan, because they have an anthroposophic center there that is Moon Maglana. And so they introduced the external treatments to the invited LGU people of Kulasi. And these are our wellness exercise in the hospital with the hospital employees, because they are mostly stressed. And this is the Antique Medical Center, Lifestyle Medicine Center, which was opened in February 14, 2019, the year before the pandemic. It is very significant because it is a heart day, it is Valentine's Day. It is already known that the heart is the most hardworking organ of the body, working 24 hours a day for our lifetime. And so with that, we will have healthy hearts. Program and activities include ITLC, or Intensive Therapeutic Lifestyle Change. And that is shared medical appointments. Usually our consultations are with just one person for consultation, but this time, and in lifestyle medicine, we have the shared medical appointments so that they can share their experiences, they can ask their doctors, and share with the patients, with their fellow patients. And walk with a doc is a walk, which is a regular activity of lifestyle medicine. It is walking with your doctor. You can talk with your doc. You can discuss your health with them. And it includes also lectures after the walk and exercises. The diabetes reversal program. This is where me with my partner in ESA Health Group here in Antique, Dr. Diana, also join. It can reverse your diabetes. It is a six-week program with lectures only once a week because of the situations right now. But you have homeworks. You are monitored every day online, and you have to submit whatever you eat. You share in the group chat, so you cannot hide. And we have weigh-ins every week. So these are the schedules. We have scheduled from July up to September for this year. And this is our first walk with a doc, which we broke world record with attendance of more than 2,000, more than what the other countries had who are practicing lifestyle medicine. And we also have a teaching kitchen station. And this is the SMA, the shared medical attendance. We have the weigh-ins. These are doctors also. Our first batch is that there are just 6 of us, 4 doctors and 2 patients. So it is a type 2 diabetes reversal program. And that is the SMA. And in Antique Medical Center, we have a PBRT, or practice-based residency training for family physicians. Of course, the PCLM, or Lifestyle Medicine, or Philippine College of Lifestyle Medicine, share the same learning goals, such as it is patient-centered, family-focused, and community-oriented approach to primary healthcare. And good news is the PCLM or the Philippine College of Lifestyle Medicine, was conferred as an affiliate specialty society of the Philippine Academy of Family Physicians on June 1, 2022, during the 61st anniversary of the Family Physicians National. And 5 doctors in Antique Medical Center are certified lifestyle medicine physicians. And some doctors, or most doctors from the different departments, also refer their patients for lifestyle change in the AMC Lifestyle Medicine Center. And our governor, Kajau, is our ally, a nurse, a gardener, and a real health enthusiast. In fact, we plan to have a wellness farm and clinic at the Binirayan Hills, including a skills training and livelihood center. The site is where the Good Shepherd Home for the Aged of Antique existed for 16 years. And we also had elderly healthcare there. But it was blocked by the pandemic. So it was not pursued. And praise God for the ESA who came here to Antique. So our sites were shifted to the hinterlands of Aning Anan. Response to health, it is also the lifestyle medicine, a response to the pandemic. So during the pandemic, healthy food sources and supplies for the frontliners were given to the different hospitals that is in partnership with the organic farmers, because we have a cooperative of organic farmers in Belison, Antique. And we have online clinic in coordination with LAMP, and that is anthroposophic medicine. LAMP is lipunan ng mga anthroposophicong manggagamot at manghihilom ng Pilipinas. So whatever online patients we have, we can also refer to them for help or homeopathic remedies or anthroposophic medicine. And we were given the healthcare guide for the management of COVID-19. And these are natural treatments, including calamansi foot bath, calamansi sponge bath, liver compress, and others, including urine. And also in response to lifestyle medicine to the pandemic, we had, because 2 of us are OB, and me, some couples who are childless come to me or call me, so online. So we have fertility clinic for childless couples. And fortunately, 3 women during the pandemic got pregnant. One is from US, so the consultation was long distance, but they are from Antique, they are Antiqueños. And the other is from Singapore, and now they are here in Antique. The twins are already 1.5 years old. And another now is 5 months pregnant from Tobias Fournier. So that is the result of lifestyle medicine, even during the pandemic. And from the DOH, we have also help from the former secretary, Pauline Obial, because her husband is from Antique and they have a farm and residence in Patnongan, Antique. So she gave us this guidebook on the proper use of medicinal plants by the University of the Philippines Research Group, or the Institute of Herbal Medicine. So we can also, this is also a source for treating our patients naturally with plants. And the PTAC from DOH also, which is the Philippine Institute of Traditional and Alternative Healthcare, has already accepted anthroposophic medicine, or LAMP, as a member of their traditional medicine group in PTAC, DOH. And what are Now, the new developments in lifestyle medicine in the Philippines. So one is the most important, PCLM is now an affiliate specialty society of the Philippine Academy of Family Physicians. And government offices are now interested in lifestyle medicine, such as the ALG and PNP, Philippine National Police. The DILG has already conducted one convention or conference for the MHOs of the rural health units, no, all over the Philippines, but only not many attended. And the PNP are now interested in making their medical officers trained in lifestyle medicine. More hospitals are putting up lifestyle medicine centers, including the Antique Medical Center. More doctors in various specialties are benefiting lifestyle medicine for themselves because they also need it, and for their patients. This is the Philippine College of Lifestyle Medicine. And we have also the school-based LM practice, lifestyle medicine practice. So an integrated farming or gardening activity and culinary arts in schools, because enculturation of optimal lifestyle starts in school. And we are also conducting lectures on lifestyle medicine in the different national schools all over Antique, starting from the north and until the south, from Libertad to Tobias Fournier in the south. That includes culinary arts, because our president, Dr. Rapalma, is also resident there in the Family and Community Medicine Department in the Antique Medical Center. And she also introduces her arts, culinary arts, and other lectures. So, ang amon reseta, wala. Our prescription na, wala ginabakal sa butika. Bulon mo lang o kung kaunon halin sa imo lagwerta. Likawan ang makapabalatian kag sundon ang makapamayad kalawas panumduman kag espiritu. So our prescriptions are not bought from the pharmacies. Just get it from your home garden. Avoid unhealthy habits and practices and do maintain lifestyle, healthy lifestyle for the body, mind, and spirit. This is our prescription. And gardening is medicine that does not need a prescription and has no limit on dosage. The healing foods. Eating is a sacred act, and what we eat is a direct connection to the natural world. Learn powerful ancient recipes, simple nutritional habits, and delicious ways to use food as medicine. Calm and clarity. The strain of the modern age affects us, especially now during the pandemic. Discover practical techniques and herbs to reduce anxiety, improve your mood, and recover from day-to-day stressors. Thanks to ESA, the Dihon Saraya and the ESA Health Group were born. And we started with the biodynamic farming in Colasi. The ICW, the tech studies on the knowledge of man, including body, mind, soul, and spirit. And we have also permaculture, mushroom growing, Waldorf education, plant studies, growing of edible and medicinal plants. And our health group members also follows or attend the IPMT or the anthroposophic medicine online. The DA's online studies on medicinal and culinary herbs and herb utilization. And also we have trainings with the DA and now the natural building. So this is biodynamic farming, and this is our first meeting in Colasi. And we also had a courtesy call with the mayor. And then we proceeded to Aning Alan, where we first had our meeting. And then the development in Aning Alan followed with a plan for a Waldorf school education and a holistic healing center or healing space. So that is our planned study. And that is the forest in Aning Alan. And thus, these are the mushrooms we were trying to grow, knowing the body, knowledge of man. And we also have stress reduction massage and the design for the future site of the healing center with the Waldorf School. And this is the Balay Kasulhay. While waiting for our wellness center in our site, this is the home of Dr. Diana, which we are presently using, if we have patients, as the Balay Kasulhay or healing home. That is the second floor, which may be converted to clinic or conference room. And these are some of our classmates in anthroposophic medicine. That is the gallery of Dr. Diana, where we could meet our patients for clinic. The bottom line is pretty simple. Take time for happiness. Allow yourself to enjoy life, fun, and relaxation. Be thankful for what you have and enjoy it. The body heals with play, the mind heals with laughter, and the spirit heals with joy. Pause, breathe, pay attention without judgment. A wise physician said to me, I have been practicing medicine for 30 years. I remember I have been a doctor for 40 years. And I have prescribed many things. But in the long run, I have learned that for most of what ails the human creature, the best medicine is love. What if it doesn't work? I asked. Double the dose, he replied. Think about this. We sacrifice our health to gain wealth. Later, or in the end, we spend our wealth to regain health. Most health concerns nowadays, like diabetes and heart diseases, are lifestyle related. If our lifestyle is a problem, then changing our lifestyle is the medicine. That's simple. So begin by making mindful, healthy choices now. Salamat gid sa pagpamati.
Thank you so much, Dr. Ellaga. So, for those who have questions, you can ask now. 1 hour lang. Comments or clarifications? I think wala naman silang question, Doc. Miss Tapati, you're raising your hand.
Hindi po, nag-clap. Thank you, I'm so amazed, Doc.
Thank you.
Yes. So thank you so much for attending the webinar of Dr. Ellaga. For those who can open their cameras, pwede po ba tayong kumuha ng picture?
Hello, Doc. Gusto ko lang pong
Yes. Yes.
sobrang ma-appreciate yung presentation, no? Especially yung um, activities nyo for lifestyle sa Antique. Gusto kong
Yes.
sabihin, sana all nandyan.
You
May
can
ganyan
visit us
kayong
anytime.
program. So progressive and so progressive and dynamic na. No? Nakakatulong especially sa mga senior. That's
Yes.
great, no?
Because
That's a great,
I have
great
experienced that.
activity.
I have experienced being sick myself.
Oh,
Yes.
yes. I'm familiar with Waldorf kasi nga po, diba? Ang mga anak ko ay
Yeah.
Waldorf. So, nakakatuwa na start kayo ng Waldorf dyan sa
Yes.
Antique. Talagang
Sana
sana
po
all.
matuloy.
Sana all may ganyang initiative.
Sec registered na po ang Dihon Saraya. It is called Dihon Saraya. Dihon is to mold, Saraya is upland. Dihon sa Iraya.
Oh, and that's the name of the school?
Yes, and we will start with kindergarten so that
Wow,
the
congratulations.
future
and good luck.
future generations will know man completely.
Opo, diba? I mean, that's really sobrang nakakainggit, no? Na
Yeah.
may
And
ganyan. Sana
our
sa lahat ng probinsya may ganyan na initiative.
and
Sana ma-influensya mo lahat. Ang galing kasi nung lifestyle nyo, nag-start dun sa
Opo.
lifestyle medicine, no?
Yeah.
And ngayon ko lang nalaman na meron ng ganyan. I'm familiar with occupational medicine kasi
Yeah.
I worked with occupational safety and health.
The lifestyle medicine was only recognized by the PMA and the Philippine Academy of Family Physicians last month.
Last month lang po yun.
Yes. But it already started since 2015.
Kasi I've been working with occupational doctors for the last 25 years of my life. And yun ko lang nalaman, may lifestyle kasi one of the problem sa occupation is not just the occupation itself, but the lifestyle of workers, no?
Yes.
Na nagpo-contribute sa unhealthy work habits and all, which ang ganda ng mga massage mo and the activities that you initiate, and then maganda rin yung sa mga senior. Yan ang kulang
talaga.
ng program for senior.
Kasi burdened na sila sa kanilang mga maintenance meds. Me, I am a retired senior, but I have 0 maintenance meds.
Opo. Ako, I'm going to senior, no? One year. Next year, I'm a member of, I'm a dual citizen. No, pero,
me, I'm 7 years a senior.
Ako, kaya lang ako, I practice early healthy lifestyle 20 years ago.
Yes.
So, wala.
Appreciate talaga.
Ako, I can relate with you, yung walang sakit and all. Hindi ko makilala ang maintenance. And I can really relate. Ang maganda kasi is ang spread wide ang practice na ito sa province nyo. Kasi dito sa Manila, nasa Manila po ako sa Quezon City. Very rare na ma-practice ito. Nagkakagulo pa nga ang Waldorf kung paano ito gagawin. No?
But we have already friends from wellness farms and the centers in Manila.
Pero hindi po ganoon ka-active kasi hindi ko naririnig
Community, kami kasi community based.
Opo, yun po yung maganda, community, no, na-influence yung buong community, and that's really ano ba ito? Ano man tawag doon? Nakakahawa. Kapag ganon kasi madami. Yung
contagious pa talaga.
At saka maganda yung yung environment nyo
Opo.
Kaya
nature talaga. Where the mountains meet the sea.
Well done.
Thank you po. You're welcome here anytime. Opo.
Ayan, pag nagpunta ako Antique, parang gusto ko bisitahin.
Yes.
Congratulations po again, Doctora.
Thank you po.
Okay. Good luck.
Thank you everyone for attending. This will be uploaded sa ESA website along with the presentation of Dr. Ellaga. Thank you. Bye-bye.
Good night.
Ingat po ang lahat.
Bye po.
Stay safe and healthy. Bye.